suturing?
See, in cervical incompetency, timely cervical suturing encirclage operation will definitely give you the better results. But if most of the time, even if with the cervical suturing, there is chances of abortions. So that time we have to consider the autoimmune factors. In that case, I usually prefer you to give Laghu Malini Vasanta tablet and Dhanvantara Kashayam, which will avoid the chances maximum. It will control the chances of abortion and you will definitely achieve the successful pregnancy.
Thank you, sir. Thank you for your wonderful answer. I hope Dr. Sucheta got the answer. And now, please guide for severe the menopausal bleeding with the endometrial thickness more than 9 flow more than 2 to 3 weeks. Could you please
Yes.
answer for this?
So this postmenopausal bleeding always will have risk of uterine or ovarian CA. So that is why if endometrial hyperplasia is there in scan, it is a compulsory protocol to do DNC and send the sample for histopathology. Once you confirm that there is no any problem, a typical growth of the endometrium, then you can treat it with conservative medicines. If there is a typical signs of endometrial tissues are there or any other malignancy signs are there, then we have to refer to higher centers. If the patient is having typical endometrial growth, cystic glandular hyperplasia type of histopathological report, then you have to give Kamaduga with Moptica, you have to give Shilajatu like Shiva Gutikas we can use, and best medicine what we can give is Uttaravasti we can practice in this case. For Uttaravasti, I use Jatyadi Taila where it will do Lekhana Karma. The excessive growth of endometrium can be removed practically, and the coming cycles she will never suffer from such complications. So that is why regularly you need to keep Kamaduga with Mauptika and Dashamolarishta. If you keep these medicines, definitely in coming days, she will never suffer from postmenopausal or the perimenopausal bleeding. Even if the bleeding is there excessive, a best drug in modern you can integrate. That drug is nothing but the government supplied chaya is there, chaya tablet. So every 3 days once she have to take chaya tablet, 30 mg tablet, starting from day 2 of cycle for 90 days, 3 months she have to take that medicine. So if 3 months she finishes, at least for 1 year you can control the excessive bleeding. So these are the two protocols we can adapt.
Sir, I think if you want, you can like keep your answers short. If you are feeling that you're running with the time, and oral medication for smooth menopause, what would be your suggestion?
Smooth menopause, no, madam.
Yes,
Menopause
sir.
will never be smooth because menopause is nothing but the transitional phase from Yauvanavastha, Madhya Avastha to Vruddhavastha. See, it is nothing but from general condition to degenerative condition we are traveling. So that is why menopause will never be smooth. It will be definitely causing many problems. The only thing is, as a doctor, if a perimenopausal patient comes, we have to counsel them with our words, give motivation, give assurance, and for patient's sake, one or two medicines we give. The best medicine which we practice in our OPDs is Daru Haridra Rasakriya. Along with that, equal quantity of Ashwagandha and Vidarikanda. So with this combination, patient will have maximum relief and what you can say that smooth menopause that can be achieved up to certain extent, madam, not 100%.
Thank you, sir. One more case from Dr. Vijay Lakshmi, madam. A female 43 years old developing fibroid even after surgery. Infertility is there. What is the line of treatment?
The same thing, madam. Here we are going to do Uttaravasti with Arbudahara Taila for 2 to 3 cycles. and repeat scanning will be done. If the patient fibroid size shows shrinkage or reduction in the size, then we allow them for pregnancy with ovulation induction. But as you told, the age is more than 40 years, we have to think about her AMH also, ovarian reserve. If her AMH is low, then Matrabasti, then Artavajanaka Dravyas like Jyotishmati Kalka or Vijayadi Churna and Kanashatahvadi Kashaya, and regularly we have to monitor follicular study. So this should be continued for minimum 1 year. After 1 year, or within that 1 year, definitely she conceived.
Thank you, sir. Thank you for your wonderful answer. And one more is please let us know treatment for pain during cycles in teenagers dysmenorrhea.
And that's again what I said you. It is pain during menstruation is apanavayu vikriti. So where if teenagers suffering from pain during menstruation, so that is totally associated with their lifestyle. There is night awakening, stress and strainful life, and most of the time teenagers they think that menstruation is a curse for them. Rather than taking it positively, they think it is like a curse. So because of that stress, they feel extensive pain during the menstruation. So whatever the mindset it might be, as a doctor, what I suggest you to give Coligo capsule, which is readily available with the Green Pharmacy, Green Remedies Pharmacy. Coligo capsule 1 TID with buttermilk after food. Even if this medicine fail to control the pain, then give 30 ml of Matrabasti of Dashamula Taila or Ksheerabala Taila for 3 days during the menstruation. This will definitely control. It is as effective as diclofenac injections and mefenamic acid tablets. It is more than that. It will give you sudden relief from the pain. Or even if Matrabasti is not there, a simple lower abdominal massage with Ksheerabala Taila and Svedana will give you very good result on the lower abdominal and the back side. So that Sthanika Abhyanga and Svedana will give you best result to control the pain. But as if there is no 100% reduction in the pain, repeatedly it will occur. But if you give the Coligo, 70% of the patient, they don't need this Sthanika Snehana and Svedana. With the tablet only, we can control the pain effectively. But in some extensive cases, we need to give Matravasti and Sthanika Svedana and Snehana along with oral tablets.
Thank you, sir. Thank you for your wonderful answer. And what is your thought regarding hypothyroidism and hyperthyroidism during pregnancy, sir? Treatment for treatment during pregnancies.
Mm, Usually hypothyroidism, madam, usually hypothyroidism and hyperthyroidism, again, it is a bigger topic, I think. So whoever asked this question, no, so I will share my number or you can share my number to them, madam. I will give them the detailed answer because hyperthyroidism will never cause any problem during the pregnancy. As a rule, TSH and usual the T3 and T4 they increase normally during the pregnancy and TSH decreases during pregnancy as a result of normal physiological adaptation. Okay. So hyperthyroidism, if it is there, due to extensive demand, that extra T3, T4 is utilized by the fetus itself. Okay. So hyperthyroidism should not, it will not demand for treatment in pregnancy. It will settle normally. But if it is hypothyroidism, then we treat that case because it is a major cause for neural tube defect, the first trimester anomalies. And the second is it is a rare cause for abortion also. That is why keeping that aspect, we give treatment in hypothyroidism. What I prefer is now the Kakla Rakshaka Yoga tablet is available in the market. Doodh Papeshwar company is producing that. If you give 1 BD of Kakla Rakshaka Yoga, definitely you can control the uh, hypothyroidism effectively. But as if nowadays The hypothyroidism, usually I refer to modern physician because I don't want to take blame with the Ayurveda, because that Kakalarakshaka yoga may control the thyroid thyroid problems during the pregnancy. But the problem is almost 85% of the first pregnancy now they are ending up with the abortions. Whatever they take modern medicine or Ayurveda medicine, 80%, 85% of the first pregnancy is ending up with the abortion. Second will grow normally, no problem in that. Okay. But the patient mentality is, if they go for another doctor, they definitely tell, see, you are having the hypothyroidism, you are having so and so problem, you took the Ayurveda treatment, what happened? Abortion is there. So you need to take the hypothyroidism tablet. They don't know the science. Like that, they blame the doctor. See, 300 rupees, 120 tablets of Thyronorm will come. Then why I have to worry about that? Just I will refer the case of hypothyroidism to modern doctor. Let him treat for the hypothyroidism. I will treat for pregnancy. This is my mentality actually.
Thank you, sir. Thank you for being so clear. And I think this is one more last question. Scanty bleeding since 3 years, just one pad per day with no other associated physical symptoms, but severe mood fluctuations before cycles. Management for mood swings and hypomenorrhea.
See, management of mood swings, it is mainly Shirodhara and Padabhyanga. These two will help best in the mood swings. But majorly the mood swing is a symptom of Vata Prakopa. Because of Vata Prakopa, there is Avarana. So scanty bleeding is there. If it is a scanty bleeding condition, the best treatment is to give Vamana. After Vamana, give Snehapana, oral Shamana Snehapana, either the Gritas or Thailas you can plan to give. So these two things will definitely improve her condition in the amount of bleeding, regularization of cycle, and also it will maintain the mood swings.
Thank you, sir. Sticking to the topic, other questions which are out of the topic will not be asked. Now it's time for the vote of thanks. And now I would like to request Dr. Dipti for